Vitaline duct fails to close. DX. Vitaline fistula. What is the key symptom of vitaline fistula? Meconium discharge from umbilicus. Poop coming out from the belly button. Vitaline fistula. What is the cause of Meckel diverticulum? Partial closure of the vitaline duct. What condition is presented with a patent portion of the vitaline duct attached to the ileum, true diverticulum? Meckel diverticulum. What is found inside the Meckel diverticulum? Heterotopic gastric and/or pancreatic tissue leading to melena, hematochezia, and abdominal pain. Aortic arches derivatives develop into 2. Arterial system. What are the precursors of the arterial system? Aortic arches. The first aortic arch gives rise to the 2. Maxillary artery. What branch of the external carotid is a derivative of the first aortic arch? Maxillary artery. The maxillary artery is a derivative of which aortic arch? First aortic arch. What are the derivatives of the second aortic arch? Stapedial artery and hyoid artery. Stapedial and hyoid arteries are derivatives of which aortic arch? Second aortic arch. Second aortic arch gives rise to stapedial artery and hyoid artery. What arteries are derivatives of the third aortic arch? Common carotid artery and the proximal part of internal carotid artery. Common carotid artery is a derivative of the aortic arch. Third aortic arch. Which aortic arch gives rise to the proximal part of the internal carotid artery? Third aortic arch. Which part of the internal carotid artery is a derivative of the third aortic arch? Proximal part. What is the derivative, on the left, of the fourth aortic arch? Aortic arch. Which aortic arch gives rise to the aortic arch? Fourth aortic arch. What is the resultative derivative on the right of the fourth aortic arch? The proximal part of the right subclavian artery. Derivatives of the fourth aortic arch. Left to aortic arch. Right to proximal part of right subclavian artery. What are the derivatives of the sixth aortic arch? Proximal part of pulmonary arteries and, left only, the ductus arteriosus. Ductus arteriosus is a derivative of the aortic arch. Sixth aortic arch. Which is the bilateral derivative of the sixth aortic arch? The proximal part of the pulmonary arteries. On which side is the derivative of the sixth aortic arch derivative, ductus arteriosus? Left only. The right recurrent laryngeal nerve loops around the right subclavian artery. Which structure is looped by the left recurrent laryngeal nerve? Aortic arch distal to ductus arteriosus. How is the bronchial apparatus composed? Composed of bronchial clefts, arches, and pouches. What is another name for the bronchial clefts? Bronchial grooves. Bronchial groove is the same as _. Bronchial cleft. Bronchial clefts are derived from ectoderm. Which part of the bronchial apparatus is derived from ectoderm? Bronchial clefts. Which part of the bronchial apparatus is derived from the mesoderm and neural crest? Bronchial arches. Bronchial arches are derived from mesoderm and neural crest. Mesoderm-derived bronchial arches give rise to muscles and arteries. Neural crest-derived bronchial arches give rise to bone and cartilage. Bronchial pouches are derived from the endoderm. Which part of the bronchial apparatus is derived from the endoderm? Bronchial pouches. Arrangement of the bronchial apparatus from outside to inside. Clefts to arches to pouches.